Hello, I'm Hannah, a mom and pediatric speech-language pathologist, providing you with exercises, strategies, and tips to help make feeding your little one more enjoyable. Today we are talking about tips to improve pediatric dysphagia, or the difficulties eating and swallowing within the home. Let's get into it. For those of you who are less familiar with pediatric dysphagia, this is either a symptom of a congenital diagnosis, such as cerebral palsy, or a symptom of acquired injury or disease, such as stroke or brain injury. Kids with pediatric dysphagia might have difficulties getting their lips to close. They might have trouble chewing and using their tongue to keep food on their teeth for effective chewing. And the most familiar issue is trouble pushing the food to the back to swallow and protecting their airway when they are swallowing. Improving any dysphagia symptoms will greatly depend on the position your child is in, how severe the dysphagia is, and your overall goal with providing solids. Are solids their main nutrition and you're trying to advance your child's skills? Or are they on a feeding tube and you're introducing solids for pure enjoyment? Regardless, one way you might be able to improve your child's eating is adjusting their positioning. If you've watched my video on the best feeding environment, you know that the optimal positioning is 90, 90, and 90. That is 90 degrees at the hips, 90 degrees at the knees, and 90 degrees at the ankles. While this is optimal, that may not always be achievable, especially for people with cerebral palsy who might have very tight muscle tone. What you do want to achieve is an as upright and centered position as possible. Centered meaning head and neck are straight, head and neck are on top of the shoulders, and the shoulders are on top of the hips. To help achieve a centered positioning, feel free to try using supports and tools, such as a neck pillow to help keep their head upright, towels or pool noodles at their sides to keep them from slouching side to side, or even straps to help prevent them from slumping or falling over. If they already are centered and upright, and that still isn't working to improve their eating, try reclining them a little, but no more than 45 degrees as that could lead to choking. Another way you might improve your child's eating is by changing the characteristics of the food. What I mean by this is try changing the size, the shape, the consistency, or even the temperature of the food. Muscle movement is driven by sensory input. In other words, your brain is going to tell your muscles what to do if it can more easily feel what it has to deal with. If you give your child regular water, try carbonated water. If you usually give diced up food that's really small, try giving slightly bigger pieces. You could try the food really cold, or you could try the food warmer than usual. You may also want to adjust and change the environment your child is eating in. For example, take away visual distractions, such as an iPad with videos, and encourage conversation with yourself or your child's siblings. This can also be done with nonverbal kids as well. Removing distractions allows your child to be more aware of what they're eating, how the food tastes and feels, and allowing them space for their brain to figure out how better to feed and swallow. Feeding is a very complex and stimulating task. Adjusting the environment could be a good way to improve the sensory input and therefore improve swallowing. Having a child with dysphagia or swallowing difficulties can be stressful and scary. Please know that you are not alone in this, so reach out to your pediatrician or your local speech or occupational therapist for some help. If you want to learn more about feeding tips and tricks, be sure to subscribe to my channel and check out my other videos. Thank you so much for watching. Bye.